The Center for Inclusion Health is a division in the Medicine Institute at the Allegheny Health Network. We recognize that in order to take care of people who live out on the streets, we actually had to go out on the streets. And probably the best way to do that was by employing somebody who came from that community. And so we started with our very first CHW. It's somebody who knows those patients intimately because they experienced that episode or that disease or that environment. And so they're very well suited to be able to help those patients who live in that population.
I'm from Homewood, East Liberty. I grew up there. 32 years ago, I was an addict myself. You know, it's such an emotional disease. You know, we like to say it is a disease of emotions. You know, some people have told me, man, that's a dangerous area. Why would you want to work down there all the time? You know, I feel an obligation to those people. I know we can't fix it, but what we can do is get individuals one at a time and try to help them.
As a trans woman who came out 8 years ago, I had to navigate the healthcare system alone. So I felt very lost. And in my time in the trans community, I've noticed a pretty severe lack of access to resources, specifically healthcare. Trans folks are often afraid to seek medical attention for fear of backlash, harassment, violence. And when I saw this position opened up, I knew it was something that I had to jump on immediately to help my community, to give back to a community that has given me so much.
The type of patients that I see is post-incarceration, people with substance abuse disorders. 31 years ago, I had an addiction and I visited the Allegheny County Jail, and it's only by the grace of God that I was brought out of there. So the people that I see, they open up to me when I tell them, I've been in your shoes. I know what you're going through. I just say, look at me. I'm a perfect example that it works. It'll work if you want it to. You got to step out on faith and just try it. You know, you can't give up.
Our community health workers, when they start doing this work, they recognize themselves and their patients, and they see how far they've come. And that is really fulfilling.
Seeing people that I help succeed adds a passion and a drive to the work that I do that didn't exist before. It's amazing what just a kind voice, the impact that that has on a patient cannot be measured.
We can lead them to the door, but we can't take them through. And so, you know, what they've done, they did. And so I don't take credit, but it's a joy to see them get better.
A feeling of euphoria, maybe. It's just amazing. I can't explain the feeling.
I would say if you're thinking about a career as a community health worker, just know that you are going to be giving back to your community in ways that you didn't think possible for even yourself.
I learned a while ago, a long time ago, that what makes me feel the best about myself is when I help somebody else. And this is a job that allows me to do that on a continual basis.
It's an amazing company. I just never worked for a company that cares for people like addicts and inmates and giving second chances and understanding their downfalls, and you don't find that everywhere.
The work that we do at the Center for Inclusion Health truly makes an impact on not just our surrounding community, but we see it have ripple effects. By addressing the healthcare of excluded populations, we elevate the healthcare for all.
A community health worker is a lifeline for people in desperate need.
Person that breaks down barriers and advocates for others.
A compassionate and empathetic leader.
A community health worker is inclusion health.